Let's take a few minutes to review your medical plans. Your medical is now through United Healthcare, and you have two options, a PPO and a high deductible health plan. Let's review the PPO first. For your annual deductible, you have a $2,000 per individual or $4,000 per family. For your annual out-of-pocket maximum, $7,150 per individual or $14,300 per family. Co-insurance is paid at 80%. For your office visit for a primary care physician is a $15 copay. For a designated network specialist, it's a $50 copay, and a network specialist is a $100 copay. Your labs and x-rays, complex radiology, and inpatient hospital is paid at 80% after the deductible. For the emergency room, it's $300 copay per visit, then 80%, waived if admitted. For urgent care, you have a $25 copay. Now let's look at the high deductible health plan. For the annual deductible, it's a $4,000 per individual or $8,000 per family. For the annual out-of-pocket maximum, it's $6,650 per individual and $13,300 per family. Co-insurance is paid at 100%. For your office visits, it's a $25 copay for your primary care physician after the deductible and a $50 copay for specialists after the deductible. For your labs and x-rays, complex radiology, and inpatient services, it's paid at 100% after the deductible. For your emergency room, there's a $250 copay per visit after the deductible, which is waived if admitted as well. And for urgent care, you have a $75 copay. Let's take a minute to review your pharmacy benefits. Under the PPO plan for retail pharmacy, you have a $10 copay for generic, you have a $40 copay for preferred brand name, an $85 copay for non-preferred brand, and a $250 copay for a preferred specialty drug. For your mail order prescriptions, you have a $25 copay for generic, a $100 copay for preferred brand, $212.50 copay for non-preferred brand, and a $625 copay for specialty drug. Under your high deductible health plan, you have a $10 copay after the deductible for generic. For the preferred brand name, you have a $40 copay after the deductible. For a non-preferred brand, it's an $85 copay after the deductible. And for a preferred specialty, it's a $250 copay after the deductible. For your mail order, it's a $25 copay after the deductible for generic. For preferred brand name, it's a $100 copay after the deductible. For non-preferred brand name, it's a $212.50 copay after the deductible. And for preferred specialty drugs, it's a $625 copay after the deductible.